ask me what the treatment is for it, and unfortunately it's not a very simple answer. And I recommend, and there's a lot of empirical evidence or research that shows that having a multidisciplinary team, meaning having people who can be on board on all different aspects of the woman's treatment. So this usually involves, but isn't limited to, those listed on your screen, if you can see that. So we have a medical doctor, specifically a gynecologist who is familiar with pelvic pain issues, a physical therapist or pelvic floor therapist, again, somebody who knows a lot about pelvic floor issues and pelvic pain issues, and then a psychotherapist to address the psychological components of having any of these diagnoses. And then another one that I think is extremely helpful is having an acupuncturist on board. So a medical doctor or gynecologist who has awareness of it is really essential for basically being able to rule out any sort of medical conditions that might be causing the pain or the anorgasmia. So if there's an organic or a medical or physical condition that's occurring, and if that can be addressed and taken care of, then the pain might go away on its own as a result of taking care of these issues. Or the doctor might need to be on board with the treatment in order to supplement the work that's done with a pelvic floor therapist, for instance, or a psychotherapist or an acupuncturist. Also, the medical doctor, I believe, needs to have good knowledge of the most recent information about pelvic pain, because a lot of gynecologists I've heard of saying to women that I've treated that they just need more lubrication or they need to relax more. And while those things might be helpful, it's not actually addressing a lot of the more complicated issues. So making sure that when talking to a doctor about these issues to really ask them what their experience is and knowledge is of vulvodynia, vaginismus. Our center has a lot of really wonderful referrals that we know of that give really excellent, thorough examinations and know what it is to look for when women are having sexual functioning issues. The next practitioner that I think is extremely important to get on board is a physical therapist or a pelvic floor therapist, again, somebody who has knowledge of pelvic pain issues and anorgasmia issues. The vaginal exam, the tightness or the structure of the muscles, and trying to figure out exactly where the muscle structure is problematic for the woman. And this is wonderfully done because they can also take into consideration muscle issues in the back and hips or the legs, as well as the vaginal muscles, and be able to address and target each one of those so that the woman can have a specific case-by-case example and knowledge of what she needs to be able to do in order to address her body in particular. And the physical therapist can also teach hands-on how to do a proper Kegel exercise, for instance. And a Kegel exercise is basically where men or women can do this, but basically tightening up those vaginal muscles or those genital muscles in order to create nice muscle tension, but also to learn and create more awareness around muscle tension so that she can be in touch with how tense her muscles are and learn how to relax them and how to sort of get the muscles working in a way that works with her body. So a pelvic floor therapist or physical therapist can be extremely helpful in doing this. A psychotherapist will be able to address the psychological components of what's going on. So a lot of women experience depression or anxiety and relationship issues, communication issues, and being able to figure out how to function in relationship as well as within herself on working through the psychological effects of what she is experiencing as a result of this decline in sex life, this decline in relationship, potentially with the other partner, because it certainly affects the partner. And I'll get into it a little bit more of how to work on those issues with your therapist or as a therapist with your clients. And then as far as the acupuncture goes, that can be extremely beneficial in working through nerves and the muscles to release the energy and to create more blood flow.